Welcome back to the channel. Thank you for joining us as we discuss a serious nationwide problem, bullying among nurses in healthcare, a critical issue. Bullying in healthcare is a widespread and alarming problem that significantly impacts the well-being of nurses and the quality of patient care. Though nursing is a profession rooted in empathy and compassion, workplace hostility has become a silent epidemic. Nurses who experience bullying often suffer from emotional distress, burnout, and diminished job satisfaction. The toxic culture caused by bullying can also lead to medical errors, decreased productivity, and higher turnover rates, which ultimately compromise patient safety. According to a report by the American Nurses Association, ANA, over 50% of nurses have either experienced or witnessed bullying at work. A study published in the Journal of Nursing Management found that 60% of new nurses quit their jobs within their first 6 months due to bullying. These statistics reveal that bullying is not just a personal struggle. It is a systemic issue in healthcare that needs urgent attention. 7 most common types of bullying among nurses. 1. Verbal abuse and public humiliation in front of other coworkers, often from management. Verbal bullying is the most frequently reported form of mistreatment in nursing. It includes yelling, belittling remarks, harsh criticism, and public shaming. For example, a senior nurse mocking a new nurse in front of patients or colleagues for making a minor mistake, leaving the victim feeling humiliated. 2. Exclusion and social isolation. This involves deliberately leaving nurses out of social or professional interactions, making them feel alienated. For example, colleagues excluding a nurse from team discussions, lunch breaks, or withholding important patient information, putting both the nurse and patients at risk. 3. Sabotage of work performance. Sabotage occurs when coworkers intentionally set a nurse up for failure. This could involve providing incorrect instructions, deliberately misplacing equipment, documents, or spreading misinformation. For example, a nurse intentionally withholding critical lab results from a colleague, causing a delay in patient care. 4. Intimidation and threats towards coworkers. Intimidation tactics involve using aggressive behavior, threatening language, or menacing gestures to assert dominance or control. For example, a senior nurse physically invading another nurse's personal space or threatening to file false complaints against them for unjust reasons. 5. Spreading rumors and gossip around the workplace. This form of bullying damages a nurse's reputation through false or exaggerated claims. For example, colleagues gossiping about a nurse's alleged incompetence or personal life, eroding their credibility and self-confidence. 6. Micromanaging and excessive criticism. While constructive feedback is necessary, constant nitpicking or micromanaging crosses into bullying territory. For example, a nurse leader excessively criticizing every minor decision a nurse makes, creating an atmosphere of self-doubt and fear. 7. Deliberate withholding of opportunities for advancement. Nurses may be denied access to career advancement, educational opportunities, or favorable assignments due to workplace bullying. For example, a nurse manager repeatedly overlooking a qualified nurse for promotions or leadership roles out of personal bias. Which nurses often experience the most bullying? Research shows that certain groups of nurses are disproportionately targeted by workplace bullying. Nurses with less than 2 years of experience are the most vulnerable. They are often perceived as easy targets due to their inexperience and lack of workplace authority. New nurses often believe that they cannot speak up. According to the Journal of Nursing Administration, 60% of new nurses report being bullied by more experienced colleagues. Nurses working in high-pressure environments such as the emergency room, intensive care unit, ICU, and operating room face increased bullying. These units often foster a hierarchical culture where junior nurses are subjected to harsh treatment by senior staff. Nurses from racial, ethnic, and gender minority groups report higher incidences of bullying. A survey by the National Black Nurses Association found that 63% of Black nurses reported discrimination or bullying at work. Temporary or travel nurses are frequently treated as outsiders and may face exclusion or lack of support from permanent staff. Nursing students and interns often experience condescension and mistreatment during clinical rotations, discouraging them from continuing in the profession. Documented facts about nurse bullying. According to a study published in Workplace Health and Safety Journal, 45% of nurses identified physicians as a primary source of bullying, while 38% reported that bullying came from nurse managers or supervisors. The American Association of Critical Care Nurses, AACN, states that bullying directly contributes to medical errors, as targeted nurses often experience heightened stress, which impairs their concentration and decision-making abilities. The ANA reported that bullying in healthcare results in 21% higher turnover rates, costing healthcare organizations millions annually due to nurse attrition and recruitment expenses. Exposing bullying is the first step toward creating a safer, healthier work environment. Here are some practical steps nurses can take. 1. Document everything that happens. Keep detailed records of each bullying incident, including dates, times, locations, and specific behaviors. Include the names of witnesses and any documentation, for example, emails or text messages, that can serve as evidence. 2. Report the behavior to manager or human resources. Utilize your organization's reporting channels, such as nurse managers, human resources, or compliance officers. Many facilities have anonymous reporting systems, which allow nurses to report incidents without fear of retaliation. Know your rights. Familiarize yourself with your facility's anti-bullying policies and your rights under workplace protection laws. 4. Engage in peer support groups. Seek out supportive colleagues or workplace allies to share your experiences. Collective reporting is often more effective than individual complaints. 5. Involve regulatory bodies. If internal reporting yields no results, escalate the issue to external regulatory bodies, such as the Joint Commission, which accredits healthcare facilities and investigates unsafe workplace conditions, where nurses can seek help. American Nurses Association, ANA, offers legal assistance, advocacy, and support services for bullied nurses. 2. National Nurses United, NNU. Nurses can file a confidential complaint with OSHA regarding unsafe or hostile work conditions. 3. Occupational Safety and Health Administration, OSHA. Most healthcare organizations offer EAPs, which provide counseling and confidential support services. Nurses can report workplace violence or bullying incidents to TJC, which has the authority to investigate and hold facilities accountable. To any nurse facing bullying from coworkers, 1. Many nurses have walked this difficult path and emerged stronger. 2. You are very resilient and strong. Your compassion and dedication to patient care are powerful forces that no form of bullying can diminish. 3. You are very valuable. Never let the mistreatment of others define your worth. 4. You deserve respect. Every nurse has the right to work in a safe, dignified, and supportive environment. If you find yourself struggling, remember that there is strength in seeking help. Speak up, stand tall, and know that you have a community of fellow nurses and advocates ready to support you. You are making a difference every day, and your courage will inspire others to stand against workplace bullying.